Hello, for my EH301 term project, I decided to create an educational guide for patients diagnosed with heart failure. Heart failure is a condition that affects the patient's quality of life for the rest of their life. These patients should receive information that they can use to make knowledgeable decisions and lifestyle changes to accommodate this condition. The pamphlet that I created is easy to read and a comprehensive guide which addresses various topics that patients must be familiar with in order to maintain a healthy lifestyle. My pamphlet is composed of 5 main sections. These sections are the heart and heart failure, medications, diet, exercise, and risk management. Each section is composed of different smaller subsections that discuss the topics at hand in detail. This first section, the heart and heart failure, educates patients on why and how heart failure occurs and encourages them to recognize the importance of treatment plans. Several sections within this topic include the functions of the heart, how different types of heart failure occur, the importance of the ejection fraction, causes and symptoms of heart failure, risk factors, and the American Heart Association heart failure stages. Doctors prescribe medications to treat the symptoms of heart failure because the underlying cause, the loss of heart function, cannot be fully recovered. This section includes classifications of medications used to treat heart failure symptoms, such as ACE inhibitors, medications to avoid, such as NSAIDs, and patient reminders for the medication regimens. Healthy and low-sodium diets assist the patients in maintaining a healthy weight and low fluid retention associated with heart failure. The subsections discuss the effect of sodium and excess fluids on the body, general guidelines to eating healthy, recommended foods within each food group, foods to avoid, salt seasoning alternatives, and how to read a food label. Patients can benefit from daily exercise because it can strengthen heart function and decrease severity of heart failure symptoms. This section includes guidelines to exercising responsibly, the types of exercises patients can perform, what patients must do as they exercise, suggestions for intimacy, and questions patients can ask their doctors as they prepare their exercise plans. The last section of the pamphlet, Risk Management, details habits to avoid, such as smoking tobacco and drinking alcohol frequently, the daily act of weight logging, and how to perform weight logging, the green, yellow, red zones, which patients can use to determine the severity of their symptoms and call for the appropriate amount of help, and generalized patient reminders. I believe that by using this pamphlet and the information contained within, heart failure patients will benefit greatly and be able to live long, healthy lives.